Get fast, reliable internet for any budget. Now qualifying customers can get Xfinity Internet free through the Affordable Connectivity Program. That's right, free high-speed internet from Xfinity. And Internet Essentials customers can get equipment included at no extra cost. Get started today.
Want your boss to put some real action behind the rhetoric when they talk about making your workplace more inclusive? Find out how to hold their feet to the fire and demand diversity on the Diversity Dude podcast.
Hello, family, and happy Black History Month. Welcome to the latest episode of the Diversity Dude podcast. Thanks again for taking the time to watch or listen to our program. I am your host, Tom Barnett with the Seminole Group. And in today's session, we're going to continue to talk about African-American health and wellness, with it being the theme of Black History Month. But as usual, before we do, I'd like to go over some recognitions for the week. The first one, Charles Drew, who by developing an interest in blood transfusions as a surgeon, came up with an innovative way to store blood, plasma, and blood banks. And his work as the director of the first blood bank project in Britain during World War II helped save thousands of lives. Number two, Dr. Jane Cook Wright, the daughter of one of the first African-American graduates of Harvard Medical School. Her father, Dr. Lewis Wright, was also the first Black doctor appointed to a staff position at a municipal hospital in New York City. And in 1929, the city hired him as a police surgeon, the first African-American to hold that position. And after earning her medical degree, Dr. Jane Cook Wright worked alongside her father at the Cancer Research Foundation, which he founded in 1948 in Harlem. And together they researched chemotherapy drugs that led to remissions in patients that had leukemia as well as lymphoma. And then recognition number three, 34-year-old Kizzmekia Corbett. She's the scientific lead for the Moderna vaccine, who felt that it was her purpose in helping lead the way in pandemic preparedness. So as we reflect on the roles that African Americans have played in the shaping of American history, let's make sure that we take the time to recognize the significant achievements and contributions that Black Americans have made in the medical field. So as I've kind of recanted some of those folks that I pulled from the past, we've got a gloried past, but we've also got a bright future. So this year, as I'd already mentioned, this year the theme of Black History Month is African American health and wellness. This is a crucial issue for those of us in the African American community, which has suffered a long history of healthcare disparities. As the pandemic continues, African Americans are more likely to be hospitalized or die from COVID-19 than white people. Besides COVID-19, African Americans are also more likely to die from diseases like cancer, diabetes, and heart disease. We have to start thinking about our physical wellness. So as I just talked about why and some of the issues reside within our community, we know that we've got healthcare disparities within the Black community. So what are healthcare disparities? That's access to quality healthcare. That might be being uninsured, lack of affordable insurance, lack of advocacy, or lack of being seen or heard. All of these showcase or highlight an overall systemic issue that resides within the healthcare system. These real issues plague our community and they've got to be addressed. But until they are, I wanted to go over some things that we can proactively do to manage our overall health. The first one, let's make sure that we schedule our annual physicals. And when I talk about scheduling your annual physical, is that let's make sure that we really have a good rapport with that doctor. And if you don't have that good rapport or that overall relationship, and they're giving you recommendations or they're giving you diagnoses, feel comfortable to seek out a second opinion, because it gets back to one of the things that I mentioned earlier, which is too many times within the Black community, we don't have that advocacy and we lack being seen or heard. And that comes back to our detriments. So as an example, I'm going to share some factoids with you all about colon cancer. African-American men and women get colorectal cancer 20% more than other groups and die at a 40% more clip. We're recommended to get our colonoscopies at age 45 instead of the general recommended 50. Let's not forget our brother Chadwick Boseman, who died at the age of 43 from colon cancer. So be proactive in making sure that we not only take those annual exams, but as they're reviewing that information, as you're going through your visit, don't just be a check the box and just I'm off to the next patient. Make sure you're asking questions. And if the questions that you're asking don't get this appropriate response or you don't feel good about the conversations in that rapport, seek another opinion, or more importantly, get another doctor. So that's number one. The second, let's become donors. There's an urgent need in both blood and bone marrow donations, which could be life-saving for people with sickle cell disease. The Red Cross is currently in the midst of its worst blood shortage in over a decade. Less than 3% of blood donors are Black. The Be the Match Foundation needs African American bone marrow donors to help sustain life for people facing blood cancers and disorders. According to the foundation, Black people are least likely to find a suitable match at 29% because we only make up 8% of the US registry. And then lastly, let's talk about mental wellness. There's a stigma in our community, that community being the Black community, about getting mental health or getting help, period, as it relates to mental conditions. I did some research, and these are some of the foundations or some of the things that are out there to really help, especially Black men, in being able to find what I'm calling culturally competent therapists. We're all familiar with Taraji P. Henson. Her father struggled with mental health, and she's come up with the Boris Henson Foundation. And the overall goal of the Boris Henson Foundation is to help in finding culturally competent therapists for people that need the assistance. There's another one, Therapy for Black Men. This provides a directory of more than 200 therapists that provide, again, competent care for Black men. Black Men Heal, that's another one. Within Black Men Heal, they offer up to 8 free sessions. So as you can imagine, they've got a waiting list out there for that one. But it all gets back to competent therapy to be able to be proactive and being able to help manage someone's mental wellness. And then there's Therapy for Black Girls. This is an online space dedicated to the encouragement of mental wellness of Black women and girls. So we've got to be proactive and build stronger health and wellness foundations so that we aren't victimized the way that we currently have been during this past pandemic. So let's make sure that we take this Black History Month to be a healthy one. So I had great conversations, whether it be emails or whether it be conversations in our last week's session around things that you could do or that we can collectively do to celebrate Black History Month. And I wanted to make sure that I threw out a couple of more things for folks to think about over the course of the remainder of February. One of those is donating to a Black organization or a charity. Things like Black Lives Matter, the NAACP, the Thurgood Marshall College Foundation, or Black Girl Code. Those are just a few that you can, take the time to make sure that you're donating to. The second one is attend the local Black History Month event. So yes, check your local newspapers across all your different cities and schools. More times than not, there's a lot of different things that are going on in that way. And the third one is just watch Black history documentation and movies. So Netflix, Disney Plus, other streaming services. PBS also offers several free videos and documentaries. So like Freedom Riders, the rise and fall of Jim Crow. My personal favorite, Malcolm X. Now that's not going to be on PBS, but that's one of those things that you can watch. But let's just make sure that over the course of February, and let February leak into February, March, April, May, make it a 12-month out of the year thing, because African American history is something that we want to make sure gets integrated across every month. But because this one we celebrate as its own special month, those are some tools and those are some resources that can assist us to be able to just make sure that we're not only more knowledgeable, but there's some great educational tools out there. So with that being said, let's just make sure, again, back to the mental health and wellness, be proactive, make sure you're getting those annual physicals scheduled, and take care. And as always, if there's any questions or commentary that you'd like to continue to have, feel free to reach out to me at tom.barnett@seminolgroup.com. So you all have a great rest of the week. Make sure that you stay vaxxed up, masked up, boosted up, And so be safe, take care. We'll talk to you later on. Have a good one.
Tune in each week and find out how to demand and implement diversity at your job. To hear more, check out previous Diversity Dude shows on ShelettaMakesMeLaugh.com.
Listen, I know how hard it is for some of us to make this decision, but if you haven't been vaccinated yet, now is the time. This Omicron variant, y'all, it ain't no joke. The only way to protect you and your family is to get the vaccine. If you're on the fence and haven't yet, I understand. I didn't get the shot at first either, because as a Black woman, I just didn't trust the healthcare system. But I did it afraid, because I didn't want to get COVID-19 and die, then leave my 4 kids without their mama. So here's what I need you to do. Call your doctor or pharmacy and make an appointment to get the shot. The state of Minnesota and Ramsey County have free clinics that offer the vaccine. You can find one near your house by going to their website at ramseycounty.us/COVID vaccine. Or simply call 651-266-1190. Do it for yourself. Do it for your family. Do it for your community.
I'm Melissa with The Greenery Minneapolis, and we are a plant shop in Mercantile. We primarily work with houseplants and houseplant accompaniments. I'm incredibly grateful to be a RISE recipient. It came at exactly the right time. I was needing the buffer income to be able to execute my vision. And the grant has allowed us the capabilities to bulk up our inventory and to be able to catch up on some of the things that we might have gotten behind on, just in the transition from moving from one space to the next. And this is really giving us the leverage and the resources to continue to move forward.